Hello, it's Rafael Gutierrez. Welcome to our channel again. Today I'm going to talk about the three Bubishi points found in the anterior portion of the neck. Anterior just means front. You'll notice that there are no Bubishi points in the back of the neck except for the base of the skull. The reason is all you have in the back of the neck is muscle. And it's really hard to get through musculature with the fist or even a weapon unless you can sever it completely clean. If you don't believe me, go get a cheap piece of meat, put something on the other side, and try to punch through it and see what ends up happening. Now, that said, I also want to talk about certain things that I found out in my own training. One of the things that I now try to stress to my kids is don't hold on to anything too tight. No ideas should really be held on to as ultimate truths. The reason is, at any minute, especially as you continue to examine everything you do, examine everything you learn, more and more deeply, you find that there are errors in a lot of things, and a lot of errors in thinking. One of the big problems that we have in martial arts is that a lot of people get stuck on what they hear or what their teachers tell them. And one of the things, if you get stuck on what your teachers tell you, or what I tell you, or what someone else tells you, and you don't examine things for yourself, is you can only get to the level where your teachers are. You can't even get there, to be honest, because your teachers will always have something that they understand better than you do. Maybe it's something they understand about their body. And so you do have to actually examine things for yourself. And a lot of people don't realize that they say stuff not because it's such an original thought, but because they've heard it and they've come to believe it, and so they parrot everything. For instance, one of the things that I've always hate hearing is when people talk about situational awareness. In essence, every person who's tried to explain situational awareness to me seems to be telling me, if you see a dark alley with the guy sharpening his knife in the corner, don't go in there. Now, if you need someone to tell you that, well, that's great. There you go. You were told, don't go into places where it looks like crimes are going to be committed. Now, the truth is, most people don't need that idea. Most people need to know that, okay, look, things happen a certain way. Especially if you're doing self-defense, things happen a certain way. You want to prevent it. This is what you want to do to prevent certain things. It's not don't go into the dark alley. It's not someone's telling you they're following you home. It's a lot of times with self-defense, you find yourself in the wrong situation at the wrong time through, I actually would say, dumb luck more. If you read Rory Miller's books, he actually mentions dumb luck or stupidity on your part. I paraphrase a little, but that's actually the thing. It's like most people don't need to be told don't go into crime scenes. It's usually common sense. So that's the reason I always hate these. Oh well, you should be teaching situational awareness. I tend to have students who are a little more mature and can understand that on their own. The other thing people actually say is stuff. Some of the stuff is really, really stupid when they think about it. Oh well, if it doesn't work in the MMA gym, if it doesn't work in a octagon in MMA, it doesn't work. Well, here's the thing. Take a Taekwondo expert. Has a lot of kicks, some spinning kicks, and everything. Well, he can actually do kicks, and sometimes they will work in MMA. Not always. And most of the best Taekwondo experts, the ones who actually know how to kick perfect, they're not going to go into MMA because, well, they have their sport. They don't want to move to another sport. And I'm not knocking MMA. Actually, I think it's a great laboratory to see certain things, injuries and aspects, because they are doing full contact fighting. But the thing is, to think that that's the only way you can learn how to fight, how to defend yourself, is negligent at best. It doesn't take into consideration a lot of things. For instance, differences in sizes, differences in ways that they do stuff, what someone's willing to do in self-defense versus a gym. If you think about it, a lot of these schools that do full contact fighting usually have moves that are illegal. For instance, a lot of them, small joint manipulations are illegal. Reason is they're harder to control and things can break easier before a judge can see, a ref can see what's happening. And so, for instance, a lot of martial arts that use small joint manipulations will not necessarily do well in certain areas. Others think, okay, well, just train in everything and you'll be fine. And one of the problems with that is you can't train in everything. Usually, if you actually look at people who are great fighters, they choose a sport and they introduce other aspects of different sports within their art. In essence, they make their art their own. And so that's one of the things that yes, I used to think that, okay, if you learn to take a hit, you're fine. Well, the thing is, there are areas in the body, which, as we're talking about the Bubishi, where if you can't really learn to take a hit there. And what I'm actually finding is a lot of times people say, oh, the Bubishi is just a legend, it doesn't work. And what I'm finding, again, with the areas of the skull, we are finding that, yes, some of these areas are places that can potentially be life-threatening or completely disabling. Now, besides that, there's the other thing that I've actually come across, and that is the whole idea of rank. Now, I know that there's a lot of ideas, oh, well, this, black belt should be this or black belt should be that. And one of the things I notice is you can usually tell a lot about a style based on looking at their shodan. I'm not looking at their higher ranks. I'm just saying the first level black belt. You can see a lot of the style. For instance, if you look at a style and their black belts can't, and they do a punching art, let's say, and their black belts cannot throw a decent punch, usually I don't see a decent punch in any of their other black belts. They're at a level that they should be able to one thing people won't argue in, a black belt should be able to the basics right. If there's not a power in shodan, they're never going to get it. There are some people who say, oh, well, certain things should be a certain way. A black belt should be able to teach a class. That's actually one of the things I believe, is a black belt should be able to teach pretty much up to a brown belt and be able to teach a good class. Now, a lot of people start screaming McDojo because, you don't have a 5th degree black belt. I don't have I have a 3rd right now. I could maybe 4 eventually. But the thing is, when you actually start looking at these, a black belt who can actually teach, doesn't matter if they're 4th, 5th, or is it that the fact that they're teaching at a high level, that their students can actually do techniques. For instance, if you have a shodan or actually even a brown belt, a EQ, and he's able to teach someone to throw a punch better than a black belt has been able to teach, well, why shouldn't that person be teaching? And if that person is teaching, then and a black belt can't teach what they are, why does a black belt have a rank that someone lower isn't able to perform, is able to outperform? I'm not trying to get into the whole, well, rank is this and that. I'm just talking about, how rank works. And there is something that I really have talked to some people about, which is kind of interesting, and that's the whole concept of rank. And lineages. There are some people who say, well, you don't need rank and lineage, just jump in and see what you can do. And that's fine if what you want to do is be able to win a tournament or a contest of that sort. It's going to vary. And so the thing is, yes, you can go into tournaments and show that, yes, you are at a certain level based on that. But there are people who can't do that. For instance, if you think about, imagine if your doctor came in with a broken eye socket because he was out in a tournament the other day. Would you really want that guy doing surgery on you on that day? Well, if you say yes, well, with a broken eye socket, he may start having eye problems and he may mess up the surgery. If you say no, well, that actually tells you that someone who's in medicine will not necessarily want to be competing because they have a livelihood. Not just medicine. You think of construction. You have guys who work construction. If they get injured off-site, they lose money. They can actually lose their job. And so you're not going to get the great martial artist who works in construction, who has a job in construction, going into rings because it's not rational for him to do it. I'm not discounting people who go and fight in gyms. That's, their thing. But what I'm saying is, a lot of times people will say, oh, well, these are the greatest fighters because they're winning these tournaments. Well, no, so a lot of times the greatest fighters won't be in there because they have other jobs. Now, going beyond that, so we have the idea that people can learn to fight and go to ring and prove themselves there. You have some people who have rank, and there's a way to look at rank. And then there's the lineage, which is actually kind of an interesting thing because I remember initially when MMA came out, people actually said, oh, you don't need lineages. You go into the ring and figure it out. And now that MMA has taken off, and you have many MMA schools, I think many people actually who even do MMA will say there's a lot of schools who teach MMA who are not qualified to teach it. What I mean is you have a lot of schools who supposedly teach MMA, but none of them have ever gone to the ring and competed in any level. They may say, "Oh, well, I know judo or jiu-jitsu and kickboxing, and now I'm teaching MMA," but that's not someone who really understands MMA. MMA is a sport which, if you're doing it, you should have competed. Now, interesting thing that I found is now you're getting MMA gyms which have lineages. And what I mean is you have someone in the gym who won or competed in MMA, developed a name for himself, and his students are saying, yes, I learned under him. The reason that's important is it shows legitimacy. If you learn under someone who has gone in the gym, yes, you at least have someone who is saying, yes, this person knows the basics as far as I can see it. If you go to someone teaching you MMA who has never gone in there, he doesn't necessarily have anything to stand on. He's saying he teaches MMA just because he says it and people are paying him for that. And, like I said, there's a lot of people, and there are some people who say, well, why don't you just put them both in the ring? And like I said earlier, you do have people who are learning MMA, who enjoy it as a sport, who want to understand what they're watching, but they never really want to compete because they have other jobs. And so, like I said, one of the things is when you start looking at this, you start looking at, you need a balance of all three different things to see what someone is actually doing. You can't just say, oh, this person competes in MMA, they're the greatest fighters. They might be, and that MMA does give them a credibility. You can't say, oh, this guy has the right lineages, and so that's the person you want to go to. They might be, but there's more to it. And so like I said, a lot of times you actually have to mix and look at and be rational about what you're doing with martial arts. And be careful repeating something that other people say. For instance, all of you have probably heard me mention a common sense. People say something because they've heard it before and they've heard it so many times that they believe it, and it doesn't matter if it's true or not. They're going to believe it because it's common sense. Everyone knows that this is it, even if it's wrong. And so that's one of the things to look at, and that's one of the things to examine. Now, I'm going to talk about the two injuries. One is to the tri area here, one is here. Now, one of the things that happens is you do have three regions of the neck, and that's why I am unbuttoning here. And what you have is the first region is coming from the thoracic area here and coming straight down here. So you have this area here. Second region is coming to the little cartilage here that comes this way. And the third one, you can actually see, is just this little area under the chin. So they call it 1, 2, and 3. 2 is the main one. Now, also here, you have actually a little triangle. You have the sternocleidomastoid here, and you have a muscle here called the omohyoid, and right in there you can feel the pulse, an artery. Now that's actually one of the areas that the Bubishi shows us is a strike point. And I'm going to talk about that one first because there's two very important structures, not necessarily big, which are in that area. Now some people will say, well, it's really small, and you will actually, if you're using it, you do have to use special fists, special finger techniques, or some sort of weapon. Be careful with that one. Now, the reason that one's so important is this. Two big structures that pass right there. One of them is the vagus nerve. And it's interesting that the vagus nerve does pass here, and it's one of the major cranial nerves, and it goes to the intestines, the heart, a lot of areas, and it helps you relax. So your heart rate, it slows it down. Your intestines, it actually can speed them up. Interesting thing is, someone was talking the other day about the intestinal nerve, and he said it came from Chinese medicine, and they pointed to that point there, which actually I thought was pretty interesting because the vagus nerve does go to the intestine. And so we did have the vagus nerve there. Now, if the vagus nerve is hit and damaged, you actually can cause, if it's just irritated first, I should say, you'll actually have your heart rate drop. And with your heart rate drops, you can end up passing out. If it's hurt and torn, one of the things that can happen is it can keep your heart from slowing down. And so you can end up causing your heart to beat too fast and end up having long-term effects from that. Heart attacks, strokes, all these really bad things that, you may survive the fight, but later on may cause problems. The other structure there is a artery called the common carotid artery. Now, the common carotid artery splits into two arteries. One goes and feeds your brain. The other one feeds the outside of your face. Now, if you hit that artery, blunt trauma has actually been known to cause pretty much a lot of problems to the artery. A lot of people who do get that end up having a mortality. The blunt trauma to that area has a mortality rate of about 23%, with no surgery, without surgery. So you think about it. Roughly 1 out of 4 people will die just from the blunt trauma there. Now, that's die. That's a mortality rate. There are actually some studies that actually study it's associated with a mortality rate of about 40%. So I'm looking at different studies, and so the thing is, you're talking about something that could potentially kill someone. Now, why it could do that? Anytime you have trauma to the carotid artery, you also are going to cause damage, can potentially cause damage to the endothelium, the lining inside. And if that happens, you can end up forming a clot in there. Problem with having a clot there is that eventually the clot will be let go and will go to the brain and kill off portions of the brain. If that happens, you can end up losing movement, you can end up losing pretty much breathing, anything. Remember, this is going to the brain, and so anything that the brain controls can end up being damaged through this. Now, when someone has blunt trauma to the carotid artery and goes to the emergency room, what most people will end up doing is they'll put them on anticoagulants to make sure that they don't clot. Like I said, these are, yes, clinical presentations when someone gets hit really hard there and they go to emergency room. There is always going to be someone who says, well, I got hit there and nothing happened. Well, it wasn't enough to be clinical. The person wasn't trying to hit you that hard, I guess. And so that's one of the big things that ends up happening is you can end up having strokes. You can end up having the a loss of function. And so, yes, again, what we're seeing is in the Bubishi, we are seeing areas that if they're hit, they can cause major damage. The other one that we actually talk about is here in the trachea. Now, this one, a lot of people think it's going to break easy. It's actually harder to break the trachea than you think. But we're talking about a really hard blunt trauma to the trachea. It can cause, actually about 60% of the trauma to the neck, external, will cause, are due to blunt trauma to the neck. And so there's a lot of things that can happen. I mean, one of the things that can happen is you can break the trachea. And if the trachea breaks, you then can end up having an inability to breathe. This is the air pipe. This actually takes the air from your nose and mouth and brings it into your lungs. So if that breaks, you can end up having a lot of problems. You can end up having it in a lot of different areas. For instance, there's one thing called the clothesline, where it comes across the side here, causing a break, and so the person can't breathe. If that happens, a lot of times surgically, they'll actually cut a little hole a little farther down, tracheostomy, so you can put a tube there so you can breathe until the swelling goes down. If it's broken, it takes a lot longer. But any area of the trachea can be broken. And if broken, you have decreased air. You cannot get air. You can't get air. You can't breathe. You can't breathe. You pretty much die. So what we see is, again, 2 more points that from the Bubishi that we do see. Clinically, they actually are potential lethal points. Now, there's a lot more that you can go into. You can go into you can actually go into the soft tissue damage. You can go into the swelling that can cause without the breaks. And so I am just going over a couple different things just to show you that, yes, these 2 points are potentially lethal. Now, I hope you enjoyed this, and if you did, please subscribe. If not, but you don't mind, please subscribe anyways. And if you're interested in any books that I've written, you can see the 2 titles behind. My Amazon name is R.H. Gutierrez, MD. Yes, I do have an MD. And most of the books that I'm writing are usually travel. 2 of them are a little different. One of them is How the Human Body Breaks using Pinan Shodan, called Breaking Points. And the other one is Clinical Anatomy book made to help people understand how to learn about the human body, which is just called Human Anatomy, A Clinical Approach. I'm trying to come out with a new version of it, which will be more complete, and hopefully will be all you need to learn anatomy. Hopefully you'll consider subscribing, and any questions you will ask me. I will continue this with the Bubishi and continue with my rants. Thank you and have a nice day.